People assume a heart attack announces itself: crushing chest pain, a numb left arm, a dramatic collapse, the kind of thing you see in a film. But past 60, some of the most dangerous cardiac events are the quiet ones, the ones that build slowly while you're asleep. No warning, no time to call anyone, no second chance. Here's what tends to genuinely surprise my patients when I explain this afterward. Those events are almost always set up by something completely ordinary, something done without a second thought before turning off the light. I'm Dr. William Lee. Years working in emergency and acute care have shown me the same preventable pattern play out again and again in people who had no idea what a handful of evening habits were quietly doing to their hearts. Tonight, I want to walk you through 5 of those habits and exactly how to undo each one simple evening at a time. Stay with me. This might be one of the more useful 10 minutes you spend all year. Why night is different after 60. Here's something most people never hear explained. The cardiovascular system doesn't switch off at night. It shifts gears. In a healthy body, blood pressure naturally drops during sleep, usually by somewhere around 10 to 20% compared with the daytime. Heart rate slows, arteries relax. It's essentially a nightly maintenance cycle the body has run your entire life. Past 60, that system gets less reliable. Blood vessels stiffen, blood pressure regulation becomes less precise, and some of the hormonal signals that once protected the heart overnight begin to weaken. During the day, the cardiovascular system has backup mechanisms that can compensate and adapt. At night, several of those protective mechanisms are essentially offline. The body is running on a skeleton crew. That's part of why the hours between midnight and around 6 a.m. carry the highest heart attack and stroke risk for older adults. Not the afternoon, not the morning rush, the quiet hours when nobody's watching, but your habits already have. What happens during those hours is largely shaped by decisions made hours earlier. What you ate, whether medication was taken, the temperature of the room. Let's go through 5 of those decisions, starting with the one that surprises people the most. Habit 1, eating dinner too late or too heavy. What time did you eat last night and what was on the plate? I ask nearly every patient this. Surprisingly often, the answer is somewhere around 8, 9, even 10 p.m. A full meal, pasta, rice, meat, maybe something fried, followed by the sofa and bed within an hour or two. Completely understandable given busy days and long-standing habits. But from a cardiac standpoint, it's quietly working against the heart. Here's the mechanism. A large meal demands a big increase in blood flow to the digestive system. So the heart has to pump harder and blood pressure rises. Triglycerides, fats circulating in the blood, climb sharply within 2 to 4 hours of eating. Now combine that with trying to sleep. The body expects the evening to be a wind down period, not an active digestive workload. And the heart ends up trying to digest a heavy dinner while also attempting to shift into its overnight recovery mode, 2 competing demands at once. For someone over 60 with even moderate arterial stiffness, that conflict genuinely matters. Research consistently links eating within 2 to 3 hours of bedtime to higher nighttime blood pressure, more acid reflux, which can mimic or even help trigger cardiac symptoms, and a higher rate of cardiovascular events during sleep. The fix isn't complicated. Aim to finish your main meal by around 6 or 7 p.m. where possible. If a later meal is unavoidable, keep it light, lean protein and vegetables, rather than something heavy and fried. Does your usual dinner schedule sound familiar? A lot of people say yes without ever connecting it to heart health. Habit 2, taking blood pressure medication at the wrong time. Pay close attention to this one because it's genuinely one of the more overlooked, preventable pieces of this whole picture. If you're over 60 and on blood pressure medication, and a large share of people that age are, the timing of that dose matters more than most appointments have time to explain. Blood pressure normally follows a daily rhythm, rising in the morning, peaking in the afternoon, dropping at night. But a meaningful number of people over 60, especially with existing hypertension, never get that normal nighttime dip. Their pressure stays elevated or even surges in the early morning hours, a pattern called nocturnal hypertension. Most people have never heard the term, yet it behaves quite differently from ordinary daytime high blood pressure. While asleep, arterial walls aren't prepared the same way for sudden pressure surges. A spike at 3 a.m. affects arteries differently than the same spike at 3 p.m. It's more likely to disturb a vulnerable plaque inside a coronary artery and more likely to contribute to clot formation. If blood pressure medication is only taken in the morning, it may simply not be active anymore during the hours the body needs it most. If a dose is missed altogether, those vulnerable overnight hours may be entirely unprotected. So, what's the move? Have a specific conversation with your doctor about medication timing. Ask directly whether taking it in the evening rather than the morning could be appropriate for you. That's a 2-minute conversation. Meaningful research, including a well-known chronotherapy trial, suggesting evening dosing of blood pressure medication can lower cardiovascular risk overnight for some people. This is not a change to make on your own. It needs your doctor's input, since the right timing depends on the specific medication and your individual health picture. But it's absolutely worth raising. Most people over 60 have simply never had this conversation. Habit 3. Undiagnosed sleep apnea. Think of someone you know who snores, a spouse, a parent, maybe yourself. That loud, irregular sound most people write off as an annoyance or a running joke. I treat it as a warning sign of heart disease until proven otherwise. Genuinely, sleep apnea is one of the most underdiagnosed conditions I see in people over 60, with a meaningful share of older adults affected and the large majority never formally diagnosed or treated, with no real sense of what it's doing to the heart every night. Here's what actually happens during an episode. Breathing stops for anywhere from several seconds to well over a minute, sometimes dozens of times an hour. Each time, blood oxygen drops, the brain registers a crisis, and a stress response fires, adrenaline releases, cortisol rises, heart rate spikes, blood pressure surges. The heart gets jolted awake while the rest of the body stays asleep, night after night, year after year. Multiply that by dozens of episodes in a single night, and the cumulative effect on the cardiovascular system is anything but subtle. Sleep apnea is associated with a substantially higher heart attack risk, strongly linked to irregular heart rhythms like atrial fibrillation, which raises stroke risk considerably, and it accelerates arterial stiffening over time. Because all of it happens during sleep, most people have no idea anything is wrong until a serious event occurs. Warning signs beyond snoring: waking with headaches, feeling exhausted despite a full night's sleep, frequent nighttime urination, a dry mouth on waking, or waking gasping or choking. If any of that sounds familiar, ask your doctor about a sleep study. My honest view: if you snore heavily, you're over 60, and you have any history of heart disease or stroke, being evaluated for sleep apnea isn't optional. It's a real part of cardiac care. Treatment, most often a CPAP device, isn't glamorous, but the evidence for it is strong. Consistent use is linked to measurable drops in blood pressure, fewer atrial fibrillation episodes, and meaningfully reduced cardiovascular risk overall. Has anyone ever mentioned you stop breathing in your sleep? Worth sitting with that question. Habit 4, cutting fluids too early in the evening. Now, a habit driven by genuinely reasonable thinking, which is exactly why it's easy to overlook. A lot of people over 60 deliberately cut back on evening fluids to avoid a 2 a.m. trip to the bathroom. Understandable, since interrupted sleep is frustrating and getting up at night raises fall risk. So fluids stop after dinner, sometimes even by mid-afternoon. The reasoning makes sense, but from a cardiovascular angle, going to bed even mildly dehydrated is a real, rarely discussed risk factor. Dehydration thickens the blood, making it flow less easily through blood vessels. For a younger cardiovascular system, that's usually a minor inconvenience. For someone over 60 with already stiffened arteries and some degree of plaque buildup, it's a different story entirely. Thicker blood moving more slowly through narrowed arteries is more prone to clot formation. Add in the fact that heart rate and circulation both naturally slow during sleep, combined with hours of stillness, and dehydration plus slowed circulation plus underlying arterial disease is part of why heart attacks and strokes cluster in the early morning hours. The fix is refreshingly simple. One full glass of water, around 8 ounces, before bed. Keep a second glass on the nightstand for if you wake up thirsty overnight. That thirst is often the body asking for exactly what the heart needs too. You genuinely don't have to choose between a good night's sleep and protecting your cardiovascular system. Habit 5, the wrong bedroom temperature. Nearly every patient is surprised this one matters as much as it does. What temperature is your bedroom at night? Most people think about comfort, not cardiovascular health. But the heart genuinely performs best within a specific temperature range, and outside that range, it quietly works harder than it needs to. Too warm, above roughly 72 degrees, and the body works all night to shed excess heat, blood vessels dilate, heart rate stays elevated, sweating increases, bringing back the dehydration issue, and sleep quality drops. Less time in the deep restorative stages where the heart does its most important overnight repair. Too cold, below roughly 62 to 63 degrees Fahrenheit, 16 to 17 degrees Celsius, causes vasoconstriction. Blood vessels tighten to preserve core temperature. Blood pressure rises and the heart pumps against greater resistance, meaningful for anyone already living with coronary artery disease or hypertension. The sweet spot for both sleep quality and cardiovascular protection sits around 65 to 72 degrees Fahrenheit, 18 to 22 degrees Celsius, a thermally neutral zone where vessels stay relaxed, heart rate stays low and steady, and sleep stays properly restorative. One thermostat adjustment, real protection at no cost. Putting it together, the heart's safe evening routine. Individually, these might sound like a lot to think about, but together they form a simple, practical evening routine. Around 6 to 7 p.m., eat your main meal, lean protein, vegetables, a moderate amount of carbohydrate if needed, a balanced dinner at a reasonable hour, giving the heart 3 to 4 hours to finish digesting before sleep. Around 7 p.m., handle water and medication. If medication timing hasn't come up with your doctor yet, let this be the reminder to ask about it specifically. 8 to 9 p.m., wind down properly. A gentle walk, reading, a relaxed conversation, and step away from screens, especially bright phone screens, which suppress melatonin and keep the nervous system alert longer than it should be before bed. By 9 p.m., prepare the bedroom, adjust the thermostat, crack a window if needed, glass of water on the nightstand. Takes under 2 minutes, matters more than it seems. By 10 p.m., in bed. And one more detail that costs nothing. If you snore or have been told you stop breathing at night, try sleeping on your side rather than your back. Back sleeping can meaningfully worsen airway obstruction while you arrange a proper evaluation. Dinner by 7, water and medication check around 7, calm evening until 9, bedroom ready by 9, in bed by 10, sleeping on your side. The evidence behind this routine is solid. The real question is simply whether you'll actually follow it, and that part is entirely up to you. A personal note. I want to speak plainly for a moment, not as someone making a video, but as a doctor. I've been in a room at 3 a.m. with a heart that stopped because a clot formed overnight in a narrowed artery. I've sat with families in waiting rooms at dawn who had no idea anything was wrong when they said goodnight just hours earlier. And in case after case, the contributing pieces weren't mysterious. A late dinner, a missed pill, a bedroom that ran too warm, quiet dehydration, an airway that had been struggling silently for years while the snoring got treated as a joke. These aren't rare, exotic risk factors. They're the background noise of millions of completely ordinary evenings. Repeated night after night, year after year, that background noise can eventually become the event nobody saw coming because nobody knew where to look. I've had to treat in the middle of the night didn't fail because of bad luck. They failed because of information that simply never reached the person in time. You have that information now. Wrap up. 5 habits, 5 fixes. First, finish your main meal by 6 or 7 p.m. Nothing extreme, just a sensible dinner at a sensible hour. Second, talk to your doctor specifically about blood pressure medication timing. Ask directly whether evening dosing might suit you. This single conversation could matter more than almost anything else on this list. Third, if you snore, wake exhausted, or have ever been told you stop breathing at night, get evaluated for sleep apnea. Past 60, that's not optional. It's part of real cardiac care. Fourth, 1 glass of water before bed, another on the nightstand. Don't let avoiding a bathroom trip come at the cost of thicker blood overnight. Fifth, keep the bedroom between about 65 and 72 degrees Fahrenheit. One thermostat setting, real protection, zero cost. Tell me honestly in the comments, which of these 5 sound familiar? I guess at least 2 or 3 do for most people watching. And if so, you're genuinely not alone. Most of my patients recognize themselves somewhere on this list too. The difference now is that you know exactly what to do about it starting tonight, not next week, not at your next appointment.